Good evening, everyone. This is Dr. Kurt Woeller. I appreciate you joining me tonight. This is going to be a very informative webinar called Clinical Treatments for Abnormal Stool Analysis. This is a little bit more heavy into clinical treatment. This is a presentation I did recently for a group of physicians who are learning about biomedical intervention, so I think this is going to be worthwhile for you. So let's go ahead and get started. Before we jump into the meat of the presentation, a few websites I want to make you aware of. You know, if you joined me before, that I am a big fan of patient education as well as physician education. I have a website. This is a great place to connect or contact me if you want to learn about the different websites that I have or connect into my office. You can just go to drwoeller.com. And then also, if you are a parent or a caregiver of an individual on the autism spectrum, and maybe you're working with a doctor, maybe you're not, maybe you're in the United States, maybe you're outside the United States, and you would just like to have a doctor that you can ask questions of, whether it's troubleshooting things for you or recommendations on a particular supplement, whatever it may be. This is a great place to do that, autismactionplan.com. And there's actually a very interactive forum that you can post questions to. And I'm on that website on a daily basis answering questions for members. Okay, so tonight we're digestive problems. We'll talk about some yeast issues. We'll dive a little bit more deeper into parasites, bowel inflammation, and then just common issues that you may be encountering with your child. If you are a practitioner, these are certainly going to be common issues that you'll encounter with your patients. So first off, let's talk about digestive bacterial problems. One of the tests that I run in my practice is a comprehensive digestive stool analysis. I generally do it from Great Plains because you not only can detect bacterial, yeast, as well as parasitic infections, but also markers of inflammation, digestive function, etc. So this is actually a section from the comprehensive digestive stool analysis identifying an overgrowth of various bacteria. Usually when you get this test back, if there is any bacteria listed under the dysbiotic flora, the lab will end up doing what's called a bacterial susceptibility test. This is a culture and sensitivity to see what type of medications will actually be most effective at eradicating that bacteria. In this particular example of the Citrobacter bacteria, they're analyzing various substances, prescription antibiotics such as Augmentin, etc., as well as natural remedies. The S means that the bacteria is sensitive to the treatment. The R means that the bacteria is resistant. So essentially you're trying to pick the S's and stay away from the R's. Okay, now yeast culture and sensitivity is a little bit more tricky. Some people will do the comprehensive digestive stool analysis and it won't show yeast, and so they'll assume that yeast is not a problem, and that's a mistake because you need to correlate this test with the organic acid test from Great Plains, and I'll explain that in a second. But if yeast does show up, the same thing applies if bacteria shows up under the dysbiotic section. They'll end up doing a sensitivity test where they look at yeast culture in a petri dish, and then they'll add different substances. And these little pellets could be an antifungal, it could be an herbal remedy, and then you look for what's called a kill zone that emanates from that tablet to tell you the overall effectiveness of that particular remedy. Okay, and so this is an example here of a yeast susceptibility test to Candida, and we notice that in this particular test of this patient, the different antifungals are effective. Difluconazole is diflucan, ketoconazole is nizoral, nystatin is a very common remedy. Well, the digestive stool analysis are more than just yeast and stool cultures. We also need to take a look and identify for different parasitic infections. Now, parasites often show up. In this particular example, we see Giardia cysts. Giardia are is a fairly common parasite. They figure about 7% of all stool samples submitted to hospital laboratories are infected with Giardia. You get it from contaminated water. This is one reason they tell you not to drink water from lakes, streams, even real pristine streams that may be in the mountains could be infected with Giardia because of animals. The common thing, of Giardia is acute diarrhea and fever. Beaver fever, for example, would be an example of a Giardia infection. Now, Giardia is a pretty nasty parasite. And again, it's found through contaminated water. It gets into the digestive system, and it creates these cysts. And these cysts are what are causing that major symptom, if you will, that we have. So it's really the infective stage of the organism. The trophozoa is another or later stage of Giardia manifestation. It's not, the trophozoa, it's really, they're passed in the stool, but they don't survive in the environment for very long. So we're most concerned about ingesting cysts. You see here in this particular example, the identification of Giardia cysts. Now, a couple interesting things about Giardia is that it will cause wide sweeping damage along the surface lining of the gut. It can cause what's called villus atrophy, which are these finger-like projections that help us digest our food. It causes malabsorption over a long period of time. It can decrease our enzyme production, lactase for causing lactose intolerance, sucrase causing sucrose intolerance. It'll also block or obliterate those surface areas in the gut that help us digest fats and oils. So it can be a significant reason for maldigestion. And long-standing Giardia infections can cause all kinds of mineral, protein, and vitamin deficiencies. It can infiltrate into the bile ducts of the body as well as the pancreatic duct, so it can affect pancreatic enzyme output. One interesting thing to note about Giardia is it's highly infectious within the household. So if your child shows up with Giardia, it's a good chance that somebody else in the house has Giardia. They should be tested. These of Giardia can live underneath the fingernails for 6 months. So again, it's a highly infectious parasite. I once found a patient who had Giardia, couldn't clear it, and it turned out her cat had it. And she was picking it up apparently from her cat. Cryptosporidium is another fairly common parasite. Matter of fact, I had just recently done a doctor consult with a patient who appeared to have an acute problem with Cryptosporidium. This is the parasite that generally is, often talked about with respect to daycare facilities for kids picking this up. It can be a life-threatening parasite in people who are severely immunocompromised. Many years ago, Cryptosporidium still is a big problem in the HIV community. Okay, so if this one shows up, realize that it certainly can be a problem. It's considered an intracellular parasite, and so it's invasive. It is invasive. It's not something necessarily that in the kids that I see on the spectrum is going to be invading throughout their body, but it definitely causes digestive problems. And again, sort of like Giardia, can cause a blunting effect or a damaging effect along the mucosal barrier. Many physicians or many textbooks you read on parasitology talk about Cryptosporidium being self-limiting, i.e. subclinical. If I find it, I'm going to treat it because I think in many people I've seen, it's a festering infection. So it can infect the entire GI tract and cause wide sweeping damage, just like Giardia. Now, Giardia, even though it's nasty, is fairly easy to treat. And some of the common medications we have is Flagyl. Now, you've probably heard about Flagyl with respects to the use in Clostridia infections. but Flagyl is also effective against Giardia. In acute situations, a one-time dose, a single dose of Flagyl can be taken, and that usually is all that's needed. But in the vast majority of cases that I see, I think we're looking more at chronic infections of Giardia, and that's where I'm going to look to probably treat anywhere between 7 to 10 days. Alinea is another medication that has been released in the U.S. over the past 5 years. It's more expensive than Flagyl. It is FDA approved for Giardia and Cryptosporidium from an acute standpoint. And Alinea for kids, usually 100 to 200 milligrams. This should say twice a day for 2 days is what's needed. And the problem with Alinea is that it's fairly expensive. So many insurance companies don't pay for it, and that's why Flagyl is a better option. Now, Cryptosporidium is a parasite that is more difficult to treat, and generally with Cryptosporidium we're actually needing to use Alinea. So Alinea is going to be more effective for Crypto. Flagyl will not be effective for Cryptosporidium. So the end result here is Giardia, generally recommend using Flagyl because it's less expensive, more readily available. Cryptosporidium, Alinea would be preferred. Entamoeba histolytica is another parasite that may show up on a stool test. It doesn't show up as commonly as the Cryptosporidium or the Giardia. However, if it does show up, it is a nasty parasite. It can cause a very serious infection. It can take over the entire bowel and cause wide sweeping damage. This is one particular parasite that can invade the nerve plexuses in the bowel, causing inflammatory bowel disease, appendicitis, etc. So this is one parasite that, from my standpoint, when I do see it, I treat it with an antibiotic. They figure about 40 to 60% of the people in Mexico who are infected with Entamoeba histolytica have liver abscesses secondary to this parasite. It is a parasite that can go systemic. It's been found in the brain, the liver, in the lungs. So again, it's not something that I will just treat with herbs. The other nice thing about Entamoeba, like Giardia, even though it's a nasty parasite, it is fairly responsive to Flagyl. So I'll usually use 10 days of Flagyl. There's another medication called Tindamax. Tindamax is a cousin to Flagyl, more expensive, less readily available, but in some cases it could be used as an alternative. So again, the upshot of this is, if you find Entamoeba histolytica, be very hesitant about treating your child with just herbs. Well, what about digestive function assessment? One of the other things on the stool analysis is looking at digestive function markers. One of the ones that comes back most commonly abnormal is elastase. Sometimes you'll find the fat stain or the vegetable fibers elevated, but it's the elastase that comes back most commonly, and it's linked to pancreatic enzyme output. So if you find that the elastase is low, it's a good indication that your child is not producing adequate pancreatic enzymes, and so supplementing with enzymes can be helpful. Sometimes you'll see absorption markers that are affected. This is not something I find all that common. Again, if this is the case, the absorption marker of fat links back to either digestive problems or some type of infection. So enzyme therapy is a useful thing to use, and I've used a wide variety of enzymes over the years. Houston enzymes is one of my favorites. They have a wide variety of different enzymes, and we'll go through each one individually. Peptazide, Zyme Prime, no phenol, and trienza. The peptizide is more of the all-around, is more of the enzyme to help digest peptides like in gluten or casein. Zyme prime is more of the all-around enzyme, fat, protein, and carbohydrate digestion. No phenol helps with some of the phenol foods. These are sort of the colorings or different ingredients in certain fruits and vegetables that some kids react to, which can cause behavioral issues. And then trienza is a nice way to go because trienza is a combination enzyme of all three. Now, in certain individuals and certain kids, hydrochloric acid problems have been detected. Unfortunately, testing for hydrochloric acid deficiency is tough. It's something that might be more easy to do in an adult, but for a kid, it's more difficult because sometimes trying to do hydrochloric acid assessments in the stomach, it's not real easy. So I have this here because the digestion process primarily for protein begins in the stomach. We do have some digestive enzymes in the mouth, and the process of chewing is important for digestion, but the meat of it really starts in the stomach with the production of hydrochloric acid. And hydrochloric acid in the stomach is very important for helping to break down protein and then triggering various factors that help with B12 absorption later on in the gut, but it also creates a sterile environment for pathogens. So there have been people that I've given this particular supplement to called Disorb, but I'll only give it to an individual if they can swallow. I will not give this, and you absolutely should not give this to your child if they cannot swallow capsules. You do not want them chewing this because it is hydrochloric acid and it can damage their teeth. No phenol, regular Houston enzyme remedy. Again, it helps with phenol digestion. Usually 1/2 to 1 capsule with a known phenol food may help lessen some of the irritability or hyperness or hyperexcitability that might come about with that. With any of these enzymes, whether it's no phenol or trienza or peptizide or zyme prime, you have to use it with caution if your child has documented inflammatory bowel disease. Now, that doesn't come up all that often, but if you have had GI assessment done where your child has been scoped, whether it's through endoscopy or colonoscopy, and identified to have some type of inflammatory bowel issue, you need to be cautious with these enzymes because it can be irritating in those types of conditions. Peptizide is a nice enzyme. This helps in protein digestion, specifically with respects to peptide digestion for gluten and casein. The nice thing about the Houston enzymes is they come in capsules and chewable tablets. Usually 1 capsule per meal for every 2 chewable is a good rule of thumb. There's no specific dose based on age or weight for these enzymes, but that's generally where I start with most kids. And then again, the trienza is a nice combo enzyme. So if you really have a hard time kind of picking which one to use, I prescribe a lot of the trienza, and it's a good way to go. All of these enzymes, by the way, are available from New Beginnings Nutritionals. So just go to www.nbnus.com. All right, bowel inflammation is a major problem that we see with many kids on the spectrum. And there's a couple things to remember here with respects to inflammatory markers. When you do a comprehensive digestive stool analysis, what you're going to be evaluating under the inflammation section are generally 4 things: lysozyme, lactoferrin, WBCs, which is white blood cells, and mucus. Lysozyme is a marker of surface level inflammation. It can come about because of a food sensitivity. It could come about because of a parasite, bacteria, or yeast. Lactoferrin is going to be more indicative of an inflammatory bowel condition. WBCs would often be high in infection, but not always. And mucus can be elevated because of inflammation, but not always. If you notice back on this particular test, 1700, This is a situation where I would be correlating it back to the bacteria and the yeast section, also looking for the parasitic section. And also, if you find this is a good opportunity to consider doing some type of food sensitivity testing, whether it's the food IgG test, possibly the food IgE test for allergy, because that may be what's causing the lysozyme to be high. Lactoferrin, on the other hand, is going to be more indicative of true inflammatory bowel disease, ulcerative colitis, or Crohn's disease. And in kids on the spectrum, and I'll have some slides here a little bit later from Dr. Krigsman, what we're finding is that many of the kids actually have a form of Crohn's, or what's called autistic enterocolitis. They definitely have a distinguishable inflammatory bowel condition, many of them, when they're able to be evaluated appropriately. Now, as I mentioned before, lysozyme can be high because of bacterial imbalances. It could be high because of parasitic infections. It could be high sometimes because of yeast and food issues. So that's an important distinction to make when you see elevated lysozyme versus lactoferrin. Well, many of the kids we know have problems in the gut, whether it's gastritis or inflammation in the stomach or lower in the intestinal tract. The most common location of gastric pain, because many kids can't tell you that they're having pain, is between the belly button and the sternum. The sternum is the bottom part of the chest bone. So if your child manifests with pain after eating, or they're waking up at night irritable, or maybe they're sweating with meals or right after meals, or they've got certain food avoidance or behaviors that come about after eating, think about the potential of gastritis being an issue. Small bowel inflammation, particularly small intestine inflammation, is quite prevalent, and it too can cause pain problems. It can cause pain in the midsection of the gut. It could cause, again, night wakening or behavioral issues after meals. So we know that the inflammation can be painful and quite damaging. Now, sometimes it's an autoimmune issue that's been set in place, possibly from a past vaccine reaction, possibly from a chronic infection, but whatever is causing it or triggering it, it truly can create problems behaviorally and medically. The ileum is a common area in the small bowel that is often inflamed in kids on the autism spectrum, as evidenced by the work that Dr. Arthur Krigsman has done, a pediatric gastroenterologist, in his evaluations. Small bowel inflammation can manifest with constipation or diarrhea. It can lead to behavioral problems, which are obviously hard to detect and determine unless your child can be evaluated thoroughly before this. So poor sleep, poor growth, food avoidance, etc. can all be indicative of a problem in the gut. If it were up to me, in the vast majority of kids who are manifesting with behavioral problems, food sensitivity issues, particularly food sensitivity issues that are leading to behavioral problems, unresolved bacteria, unresolved yeast issues, it would be, if it were up to me, I would have them scoped. I would definitely want to have somebody like Dr. Krigsman or another type of pediatric specialist who recognizes these problems in autism to go in and do a thorough evaluation of the gut to make sure that we're not dealing with some type of insidious inflammation that is characteristic of inflammatory bowel disease. But I understand that that's not always available for people, and that's the unfortunate aspect of what we're all dealing with. However, there are means of intervening that can be done at home. There are various medical diets, and probably many of you have implemented things like the gluten and casein-free diet with your child to see if that might help. All of these medical diets, whether it's a gluten casein-free, a specific carbohydrate, a GAPS diet, low oxalate diet, whatever, the common goal is that they're trying to help reduce inflammation, trying to improve digestive function, optimize nutritional absorption, and essentially eliminate the toxicity issues that are found in the bowel that are then affecting your child behaviorally and cognitively. From an inflammatory bowel disease standpoint, one of the most popular diets is the specific carbohydrate diet, which was developed by an individual called Elaine Gottschall. She has written many books over the years. Breaking the Vicious Cycle was the first book, and if you go to breakingtheviciouscycle.com, you can learn much more about the diet for essentially inflammatory bowel disease. I have seen many patients over the years, many kids over the years, do extremely well with this particular diet because the upshot is this: you're eliminating certain specific carbohydrates, primarily complex starches, what are called disaccharides. These are the two sugar molecules found in gluten or rice or corn or potatoes because they are found to be triggering inflammation along the surface or the mucosal lining of the gut. So eliminating those over time helps to reestablish some normalcy in gut function, reducing inflammation. And this has been a godsend for many individuals, not only kids on the spectrum, but adults with inflammatory bowel disease. So again, breakingtheviciouscycle.com is a great place to learn about the specific carbohydrate diet. If your child has known inflammatory bowel disease, if you've done a stool test and you find lactoferrin high, or you just have a suspicion and a gut instinct as a parent that this is probably an issue, many people will actually just move ahead with that diet and get good results. There is a medication. It's not an alternative to the specific carbohydrate diet, or I guess you should say not an alternative. It's not a replacement of, but it's a medication that has been helpful for many individuals, not only kids on the spectrum, but people in general who have a lot of food sensitivities. It has been shown to help improve leaky gut, and it's called Ketotifen. Ketotifen is still found in eye drops. Matter of fact, there's a particular product that you can buy over the counter called Zaditor, which is helpful for allergies that affect the eyes. Now, it turns out that what Ketotifen does is that it decreases histamine, specifically histamine-mediated allergic reactions along the surface lining of the gut that are often triggered by foods when this particular substance is taken orally. Now, there are only so many compounding pharmacies make Ketotifen in a palatable way. Okay, so we're actually not taking the eye drops, but what we're doing is we're getting either Ketotifen oral suspension or Ketotifen capsules and taking them orally. Usually, the benefit of Ketotifen is seen over time. It's not something that I've seen help within a week. I generally tell people give it at least 3 weeks before you start to recognize noticeable changes, and minimally a 2-month trial would be recommended to take Ketotifen. I've had some people who've taken it longer, taken it 6 to 9 months, and really felt that it's helped. Some parents have felt that it's really helped decrease some of the food reactivity that they see with their kids. Because it's an antihistamine, it can be a bit sedating. So that's just something to watch for. What I usually do when I start Ketotifen is I'll actually give an evening dose so that the person has a chance to kind of build up a tolerance to it. If it does cause any kind of sedation, it might help with their sleep, and then slowly start to increase a dose with breakfast, a dose before lunch, a dose before dinner, but stretching it out over a couple weeks. Okay, so everybody's a little bit different as far as their tolerance of something like Ketotifen, but that's one way of doing it. Some special precautions would be in diabetes, which is not something common in autism, and epilepsy, which certainly can be. Despite that, I've not seen any adverse reactions in using Ketotifen with individuals on the spectrum. Now, some of you have probably investigated or heard about camel milk. Camel milk has become popularized from some of the educational work that Julie Matthews has done. Julie Matthews is a biomedical nutritionist, and I've had a number of parents who are getting camel milk here in the U.S. And seeing very nice results with it. Now, it's a new substance for many of us here in the western part of the world, and certainly, you know, a lot of us haven't been exposed to camel milk. It doesn't carry the same reactivity that you would get with cow dairy, so it's generally safe to use in individuals who have a cow dairy sensitivity. Also, we're not seeing the peptide effect that you get with cow dairy as well. The nice thing about camel milk is it has a regulating effect on the immune system, so it can help to shift the mucosal immune system reactivity to other foods. And I've actually had some kids on the spectrum who've been using it for 2-3 months and became much less tolerant to some of the other foods that they were reacting to. Everybody's a little bit different about how they will respond to camel milk or how much to use. You know, sometimes 2 to 4 ounces a day is all that's needed. Some kids who are really sensitive or who have known inflammation in the gut may only be able to start with a tablespoon a day and start to build up a tolerance. You can go to nourishinghope.com, do a search for camel milk, read Julie's article, and do some investigative work on camel milk. Apparently there is a Facebook group on Facebook dedicated to camel milk as well. So there's going to be a lot of other parents out there who can give you feedback too on their experience in using camel milk. Well, there are a wide variety of remedies to consider with respects to the wide variety of problems that you'll see when you do a comprehensive digestive stool analysis. A group of remedies that has been helpful not only for adults, but I've been seeing it helpful for kids on the spectrum. This is something I'm using now more and more. Come from a company called Botanical Research. And one of the things that I've recognized is that many kids really need their guts cleaned out if you can. They either have chronic constipation or chronic bowel toxicity. And it's difficult to break through some of these issues when they constantly have these ongoing bowel problems. Now, admittingly, some of it could be due to bowel inflammation. And we're always looking for new ways and effective ways of trying to improve gut function as much as possible. Botanical Research has a nice line of products that are, generally well tolerated for individuals and generally, easy to implement. The GI Detox is a particular product that's it's a clay substance with some activator charcoal that helps to bind up some of those toxins in the gut and prevents them from being absorbed. You've probably, seen or used activator charcoal before, whether it's trying to prevent the die-off effect of bacteria or yeast, or maybe during a biofilm program, etc. And this particular group of remedies as part of a BioClear cleansing program has been helpful for some kids. Biocidin is more of a wide sweeping anti-pathogen herbal remedy. And so it's not only effective against bacteria, it's also been effective against yeast. I've actually seen it effective against Blastocystis hominis. Blastocystis hominis is a particular type of parasite that will often show up. It doesn't carry the same pathogenicity of Cryptosporidium or Giardia or Entamoeba histolytica. So it may be something that I would be more inclined to treat with an herbal remedy. But biocidin from Biobotanical comes in a liquid and capsules, and this is a nice addition to a GI detox program. And biocidin essentially is a blend of different herbal remedies known to have an effectiveness against a wide variety of different pathogens. And you don't have to use a lot. That's the nice thing about the biocidin. You don't have to use a lot of it. It's very concentrated. And the beautiful thing about the Biobotanical website is that there's really good support information for you to read about each product. And as I'll point out here in a second, there's actually a form where a chart that you can download onto your desktop that gives you specific dosing recommendations based on age and weight. Olivarex is a broad-spectrum olive leaf extract remedy. Olive leaf has additional benefits for bacteria and yeast. It's also something that can be helpful for viral infections as well. So this could be something that's added on. I would say out of everything I've presented here, Biocidin is the one anti-pathogen herbal blend mixture that I use most commonly, and then I will at times Rex as well. So to learn more about these additional remedies with respects to bowel detoxification, decrease of pathogenicity in the gut, you can go to biobotanicalresearch.com, or you can go to biocidin.com and read about each remedy. As I mentioned before, there's something called a product usage chart that you can download and just copy it to your desktop for easy reference. It's a nice color chart that kind of breaks each remedy down and how to dose it, so it's all that information's right there. And then, if it's something that you're actually interested in trying, you do have to set up an account. In an account code that can be used is ERA, so you can write that down. Well, what about probiotics? There are a wide variety of probiotics to consider. They all have different usefulness. There are general overall probiotics that are just healthy and helpful for the digestive system. Probio Premium and Probiotic Support Formula are well-rounded, multiflora, multi-spectrum probiotics. The Probio Premium actually being very high potency. So those would be a little bit more something that would be useful for just an overall healthy way of replenishing some of the bacteria in the digestive system. The Therabiotic Complete that you see down here at the lower right hand, again, is a multiflora probiotic. They all can be helpful with respects to yeast. They all can be helpful with respects to bacteria in general. But you'd think about something like the Probio Premium if you're really trying to get the probiotic count very high. Maybe that's because of oxalate issues, or if you happen to be doing a protocol and using ibuprofen, which is what some kids are doing to help with inflammation, then you'd want a much higher dose than you might get in some of the other three. Let me go back real quickly because I don't have a slide on this, but there are some other treatment-specific probiotics. Culturelle, for example, is a probiotic that is really specific for Clostridia. Okay, so you think of Culturelle if you have a Clostridia issue, and that's often detectable off an organic acid test. VSL3 is another probiotic that's very high potency, very similar to the Probio Premium in its organism count per dose. The VSL3 is something that can have some effectiveness against Clostridia, but it's something that's used more commonly when oxalate levels are high. So if your child shows up with high oxalates from an organic acid test from Great Plains, you'd be looking to use something like VSL3. 3-lac, not Theralac, which you see down here at the lower left corner, but 3-lac is a remedy or a probiotic that's been used with good success for chronic yeast problems. So I think of 3-lac as more of a yeast treatment probiotic. All of these remedies that you see here, the Probio Premium, the probiotic support, the Theralac, the Therabiotic Complete, the Culturel, the VSL3. Those are all available from New Beginnings Nutritionals. The 3-lac is something that you can find online. Okay. What are some other issues that you may encounter? If you're a physician, these are certainly going to be issues that you encounter in your practice. If you're a parent, you probably are already recognizing these. Let's go through a few examples. Abdominal bloating, very common, okay? So to troubleshoot the issue, I want you to think about what could be causing your child to have a distended abdomen. First off, think of gas, okay? Either from yeast or bacteria. There's a reason that yeast is put in bread, is it causes the bread to expand. So an underlying yeast problem could cause a distended abdomen. The other thing that could cause it is constipation, backed up stool, causing stool compaction. It causes back pressure in the gut, and that can cause your child's belly to expand, usually very hard and rigid. A lack of digestive enzymes. The pancreas or their pancreas is having a difficult time releasing enzymes because they're not digesting their food effectively. That can lead to bloating. Hydrochloric acid deficiency may also be part of that. Chronic inflammation, okay, certainly could be a contributing factor. Some of these things, obviously, you need to have testing done to identify. The lack of intestinal motility. There's not enough nervous system input to cause peristaltic activity. That usually is going to cause constipation. Of this list, the most common thing that causes abdominal bloating is constipation and yeast. Constipation is such a major problem that it's one of the first things I think about when I have a parent contact me when their kid is having aggression issues, self-injurious problems, or just behavioral issues in general. Okay, I want to know, are they moving their bowel? Are they getting the poop out? How often are they having a poop? What you'll often find, and this is an actual picture here from a patient in my practice, this was one piece of a large stool that was lodged in this child's abdominal system. The parent actually, as a reference point, put a police flashlight next to it to show how large it was. This was a particular kid who had severe aggression problems, and his aggression diminished as he became less constipated. But think about it. Constipation like this can lead to cramping, which can lead to pain and discomfort. That can lead to behavioral issues. Constipation can lead to a backup of toxins in the gut, okay, whether it's from yeast or bacteria, or just metabolic toxins that get generated on a daily basis, being filtered through the liver and into the gut, but it has nowhere to go. So those toxins get reabsorbed and can interact and interfere with brain chemistry. So we know that constipation can be a major issue. In severe long-standing constipation, patients, including kids, can get what's called Megarectum, where they retain these hardened masses of fecal matter, and it just causes a back pressure up from the lower pelvis, moving northwards through the digestive system, leading to bloating, leading to pain, leading to discomfort. So we know that constipation can be a major issue. So when thinking about constipation, first and foremost, rule out yeast, rule out bacteria, rule out parasites. Now, sometimes individuals have worm infections, not easily identifiable, even on a stool test, but there could certainly be a suspicion that might be occurring. Them itching the rectum, worsening behavior around a full moon are all suggestive of worm infections. A common treatment used for things like pinworms and roundworms is an antibiotic called Vermox. It comes in a 100 milligram chewable tablet. You take one tablet twice daily for about 3 days. I will usually repeat it in about 2 weeks. And in some cases, not all, but in some cases that's helped with some of the constipation problems. There are other things that can be done to help with constipation. There's not just one, but multiple things. Ever-increasing amounts of vitamin C powder. When your body and when you take too much vitamin C and your body can't absorb it anymore, it'll cause diarrhea. It'll cause a laxative effect. That's not a bad thing for somebody who's chronically constipated. Many of the high-dose probiotics that I mentioned before, the Probio Premium, the VSL3, are already high organism counts per dose. When the body has had too many probiotics, it often can cause loose stools. Okay, it doesn't mean it's toxic. It just means that the body is, there's a lot of fluid in the bowel. Magnesium has also been used and helpful for constipation. Citrate, oxide are two good forms of magnesium that are often used for constipation. And there's a wide variety of other things too. Some kids need enemas, okay, whether it's using a daily enema for 3 to 5 days along with some magnesium to help get their bowel cleaned out. The point of this is I want you to be aware that constipation is an ongoing problem and can be an ongoing problem for many kids, and it's very difficult to get control of their yeast and bacteria, which could be contributing to their behavioral issues if they chronically are constipated. Well, what about diarrhea? Because now we're talking about the other end of the spectrum. There's a couple things I want you to be aware of with respect to diarrhea. First, you need to identify what's the potential source of it. Okay, is it from yeast? Is it from bacteria? Could it be a parasite? Could it be Giardia, which is what this picture's showing? If your child has continuous diarrhea or loose stools, it's probably some underlying problem of inflammation, okay, or an infection. If it's intermittent, meaning it just periodically occurs and there's no rhyme or reason to it, then it's likely food-related, like a food allergy. If it's cyclical, okay, occurs on a 7 to 10 day cycle or so, happens for a couple days and it goes away, then it comes back and it's pretty consistent, you're probably dealing with some kind of parasite. If you're getting alternating diarrhea and constipation, that's always a little bit more confusing. Again, it could be related to an infection. It could be that your child is constipated and then having stool leak around the block. In some cases, I've had kids who hold their poop. They don't poop until they get so much that it all comes out by itself, and that can kind of create problems there as well. So the intermittent usually is going to be some kind of issue with stool impaction or chronic inflammation. So again, continuous, it's either an infection or inflammation. Intermittent is usually related to food. Cyclical, consistently, generally parasitic, and alternating between loose stools and constipation. Think of either stool impaction or chronic inflammation. One of the other things that I often ask parents in my practice is, does your child, or if you're a doctor, does your patient do this? If you have a child who is leveraging themselves over furniture, okay, whether it's at the edge of a table, a chair, of a couch, whatever, to try to find a position of comfort, they're definitely or most likely dealing with some type of abdominal pain. And certainly could be because of abdominal inflammation or severe constipation. And this is actually a picture from Dr. Krigsman. This is abnormal, okay? This is not normal stool. Periodically, we may all experience an episode of loose stool, okay? But if this is an ongoing issue with your child, this is pathogenic. This is indicative of some severe underlying intestinal problem, probably inflammatory bowel disease or at least some type of serious infection. And if you're a parent out there where your child's stool looks like this, and you've been given turned away by traditional doctors who say, that's autism, that's normal. you need to find another doctor who can help, or another good way to actually try to push the issue is to go into your pediatrician's office with a diaper like this and plop it down on their examination desk and then tell me this is normal. That usually gets their attention when you can stink up their office or stink up their examination room with a putrid, foul diaper like this. So in my book, this is something that needs to be investigated medically. And then certainly in extreme situations, many kids have become self-injurious because of the pain and the dysfunction that they have going on in the digestive system. So self-injury behavior, I guess the question to ask is it a normal part of autism? In many cases, it's actually triggered because of pain. And from my standpoint, that behavior warrants medical investigation and not just assuming that it's part of the autism spectrum. I encourage all of you who have some type of concern or some suspicion with respects to your child's digestive system, or if you're a practitioner who is dealing with kids now on the autism spectrum, to check out the information by Dr. Krigsman on gastrointestinal pathology in autism through the assessments and the imagings that he has found and has researched and published. You can actually find out more about his articles and his presentations at this website here, autismgi.com. Krigsman is a pediatric gastroenterologist who works down in Texas as well as New York, and he, for me, has been my go-to pediatric GI referral for patients in my practice for the past many years, and has been able to detect and diagnose true inflammatory bowel disease for many of the kids in my practice on the autism spectrum. Okay. Again, I know I've gone through a lot of information here tonight. It's impossible to go through every protocol or to go through every scenario. But what I wanted to give you was an overview of some of the digestive issues that you may encounter or have encountered with your child or encounter in your practice if you're a healthcare practitioner. The comprehensive digestive stool analysis from Great Plains, again, is very comprehensive. You also absolutely want to make sure that you do the organic acid test too, because the organic acid test has other markers, HPHPA, for creosol, for example, which are specific for Clostridia bacteria that aren't detected on a stool test. And then, of course, the other toxins from yeast. So the stool test is a powerful assessment to be coordinated along with the organic acid test. And then obviously there's a wide variety of different treatment options. If you have questions, if you have concerns, if you're needing some help or assistance, want some additional suggestions, whatever it may be, then please feel free to join me along with the other parents on the parent forum at autismactionplan.com. You can even post me privately through that website too, if you prefer. and then, of course, I have a wide variety of already recorded webinar and information that is accessible to you on topics from methyl B12 therapy to brain inflammation and treatment to cerebral folate deficiency, etc. You can find those at autismseminarsondemand.com. So let me see here. Okay, so that was it. Okay, so with that, I will conclude the presentation. I'm not able to take questions after these presentations. If you did happen to post a question to Great Plains, they will catalog it, they will send that to me, and I'll respond that way. But again, if you really want to get more into the meat of things with my input, whatever it may be, the best place to do that is at autismactionplan.com. All right, everybody. Thanks so much, and have a great evening.